Hello, my name is Dr. Manish De. I am a pain management specialist, and today my topic is on neuropathic pain. I have discussed about different types of pain in my last video. So in this video, I will like to talk about the one of the types of pain, which is a neuropathic pain. So neuropathic pain or nerve-related pain or neurogenic pain, it starts from a particular source of a nervous system. So our whole body is supplied by different kinds of nerve. One is the somatic nerve, that is the touch, pain, some type of sensations, warm, cold, temperature sensations. Those are carried by those kind of nerves. Along with there is also a sympathetic nerve. Sympathetic means some sweating and some area where we actually feel different kinds of warm sensation in a different kind of manner when the blood pressure and heart rates are regulated. Those are sympathetic kind of nerves. So somatic and sympathetic systems, when these nervous systems are involved, then this neuropathic pain is actually denoted, or the neuropathic pain is defined when this nervous system is actually involved by a particular disease. So how the patient presents with neuropathic pain? So neuropathic pain patients present with pain starting from an area and radiating to a particular another area, like from neck to the upper limbs and from the lower back to the legs. This is a common kind of pain, and the character of pain will be like a pin pricking sensation, like any or pin sandal sensation, when there is a sharp kind of pain and there is a kind of pain which is very discomforting in nature, and also which causes disability, like walking disability or any movement disability, like it will be difficult to move your neck and shoulders, difficult to move your limbs, and difficult to move your back when you're walking or standing up from sitting down. And those are the areas where neuropathic pain actually hampers daily activities. So involving the nervous system, there might be sensory and motor loss. There might be some loss of sensation, like you can have some touch sensation may be lost. There may be some heaviness in the legs, and there may be also some slippers coming out while you are walking, and those are the kind of sensory and motor sensation lost, which is another red flag sign for which a neurosurgical referral is done. Other things like bowel and bladder controls, those might be lost also, and those are the areas where neurosurgical referral are usually done for the surgery of the lower spinal cord and the area of the compression where the neuropathic pain is originating. So the neuropathic pain, I will show you a model through which it will be better for you to understand. One is this is a model of the spine. It's a short model, and these are the two vertebral bodies, and this is the spinal cord. This is the nerve, and this is the disc between the two vertebral bodies. So whenever there is a disc prolapse due to wear and tear or due to heavy weight lifting, due to age, when there is desiccation and all, this disc actually compresses on this particular nerve, and these are the two nerves, that nerve rootlets that is coming out of the main spinal cord going to the legs, or it can be happening. It can happen in the neck also, going to the limbs, upper limbs or the hands. When there is a compression on these nerves, there will be altered sensation. One will be the pain, another will be loss of sensation or altered sensation, like paresthesia. When there is a slight touch on the area will be painful, or in a trivial trauma, when you just hurt or fall down, when it gradually is a very trivial fall down, there will be severe pain. So these are known as allodynia or hyperalgesia. So allodynia is basically when there is a increased sensitization of the nervous system. In the periphery is called peripheral sensitization. In the central nervous system, in the spinal cord and the brain, those areas, the chemical release are increased, and there are different kind of receptors which are hyperactive, like NMDA receptors. Those causes the increased sensitivity of the trivial pain. So this is called a sensitization when the pain is increased even on touch. So this is the characters of a neuropathic pain. And how will we diagnose? By asking the patient's history and examination, and then we talk about the investigation, some basic tests which we do by slit-leg rising or particular test of nerve compressions for median nerve, like carpal tunnel syndrome is a kind of neuropathic pain when the median nerve is compressed over the wrist. And also there is another kind of neuropathic pain, trigeminal neuralgia, where the region of the face is involved, a sharp pricking sensation. And there can be another pain of post-herpetic neuralgia, when there is a infection by herpes virus, then it can along the dermatoma, along the particular area of the body, there may be a sharp pricking and burning sensation. So this is a kind of pain which is very discomforting in nature, and for that we need to diagnose it clinically and do some blood test, routine blood test to see whether there is an inflammatory component or not, and give some medicines. So whenever we have kind of pain, we try to take some painkillers over the counter like paracetamol, ibuprofen, diclofenac. But this kind of neuropathic pains doesn't actually respond to those analgesics. So we have to give some other kind of medicines in a proper titrated dosage, like pregabalin, gabapentin, duloxetine, nortriptyline, amitriptyline. These are the anti-neuropathic medicines which has to be given in a proper dosage so that there are least amount of side effects, because they act in the spinal cord level, and it has to be given after a consultation with a pain physician. And so take home message from this video is basically, whenever you have a kind of pain radiating from a particular area from the neck or the lower back to the legs or a particular area of the body, and it's a sharp burning pain, try to consult with a pain physician rather than going to an over-the-counter medicine. If it is diagnosed with a neuropathic pain, then proper dosage should be given of the particular medicines. And another take home message is, if the medicines are not working in the initial phase to 6 weeks or 3 months, then there are different kind of nerve blocks which can be done in particular area of that involved nerve, so that the neuropathic pain can be get under control, and so that your daily activities are not hampered. Okay, stay healthy, stay blessed. If you have any questions, you can write in the comment box. Thank you.